How do MSU crystals in joint fluid confirm gout? Imagine a tiny crystal that holds the key to diagnosing a painful joint condition. When doctors suspect gout, they often turn to analyzing the fluid inside the joint, called synovial fluid. This fluid acts as a lubricant, but it can also reveal important clues. The most definitive way to confirm gout is by finding monosodium urate crystals in this fluid. To do this, a healthcare professional performs a procedure called arthrocentesis, where they carefully extract a small amount of joint fluid using a needle. Once they have the fluid, they examine it under a special microscope called a polarized light microscope. Under this microscope, monosodium urate crystals appear as tiny, needle-shaped structures. These crystals have a unique optical property called negative birefringence, meaning they change the way light passes through them in a specific way. This negative birefringence helps distinguish gout crystals from other types of crystals that can form in joints, like calcium pyrophosphate crystals seen in pseudogout. The needle shape and optical properties are like a fingerprint, confirming that uric acid has crystallized in the joint. Finding these crystals is crucial because it directly shows that uric acid has precipitated out of the blood and into the joint space. This crystal formation triggers the intense inflammation and pain typical of gout. While blood tests can show elevated uric acid levels, they are not enough to diagnose gout on their own because uric acid levels can fluctuate and sometimes be normal during an attack. Therefore, seeing the actual crystals in joint fluid provides the most accurate confirmation. It's also worth noting that the crystals found in joint fluid are usually shorter and thinner than synthetic crystals prepared in laboratories, but they still have the characteristic needle shape. In addition to crystal detection, doctors may measure uric acid levels in the joint fluid, but this alone isn't enough for diagnosis. Imaging techniques like ultrasound can sometimes help, but they do not replace the importance of directly visualizing the crystals. In summary, the presence of monosodium urate crystals in joint fluid is the gold standard for confirming gout. It provides clear, visual evidence that uric acid crystals are causing the joint inflammation. This precise diagnosis helps ensure patients receive the right treatment and management for their condition. If you experience joint pain or swelling, it's always best to consult a healthcare professional for proper testing and diagnosis.